The death of General Colin Powell, who was fully vaccinated but battling cancer, highlights the risk of breakthrough COVID-19 infections. The CDC says just over 7,100 Americans have died after experiencing a breakthrough infection. Now, that is out of 187 million Americans who've been fully vaccinated. The Fox Medical Team's Beth Galvin has more.
Severe breakthrough infections in people who are fully vaccinated against COVID-19 are still relatively rare, but they can occur. And one Metro Atlanta cancer doctor says the death of General Colin Powell is a reminder that this virus is still out there and it's still a threat. But he says there are some simple things that you can start doing today to lower your risk of exposure, even if you're someone considered at high risk of complications of this virus.
Many cancer patients and survivors, older Americans, and people with weakened immune systems have spent nearly 2 years on edge about the coronavirus. And Dr. Jeffrey Metz, Chief of Staff at Cancer Treatment Centers of America, Atlanta, says the death of General Powell, who at 84 was battling a blood cancer when he contracted a breakthrough infection, comes at a time COVID-19 cases are dropping and many people are struggling with what he calls alert fatigue.
We're tired of being inside of the house. We're tired of not getting outside. We're tired of, I've done everything right. I've followed all the core concepts, and yet something like this can still happen. It's a reminder, yeah, it can.
Still, Dr. Matt says there are a lot of variables that cancer patients and older adults with weakened immune systems can control to lower their risks. First, he says if you haven't gotten vaccinated, get your shots. And if you're eligible for a booster, get that too. And Matt says stick with tried and true prevention basics like wearing a mask, washing your hands frequently, and staying 6 feet apart from other people in public settings.
But that social distancing part really is where you can get smart. And that's by, how do you reduce your risk from happening? And a lot of that's exposure.
And with the holidays around the corner and the high travel season beginning, Metz recommends people with underlying health conditions talk to their care team about their travel plans.
There are plenty of patients out there that have cancer that are in a very strong, immune state. They've completed their treatment and they've done well, and they've had the vaccine and they've had the booster, and for them, they're in a much better position versus somebody that might be under active therapy.
For those who are undergoing treatment or taking a medication that can suppress their immune system,
they really want to try to look at the way that they're traveling, the risks that they take. Where can they prevent risks from happening? When you're coming in contact with hundreds and hundreds and thousands of people, you don't know where they've been. You don't know who's vaccinated and who's not vaccinated.
And Dr. Matt says if you are at higher risk of complications, you may want to think about driving to your travel destination rather than flying, and choosing to go to a smaller holiday gathering where you know the vaccination status of everyone around you rather than a large gathering. For your Fox Medical Team, I'm Beth Galvin.